So in this, we are going to focus on something absolutely essential, the extension of isolation. Now, before we even see the patient, there is a small optional step that is recommended and it really helps during the procedure. That is marking a little identification corner on your rubber dam sheet. Usually we do this in the upper left corner of the rubber dam. You can either use a marker or a small punch for this. And here is why we do this. When you are about to place the dam on the frame, this corner helps you orient the sheet correctly almost instantly. It's not mandatory, but honestly, it saves a few seconds and avoids that little moment of confusion, especially when you're trying to work efficiently. So once this is done, the real planning begins. Deciding where to punch the holes, which we call the extension of isolation. And this is really where the type of procedure changes everything. For example, in endodontics, you only isolate the tooth being treated. That's it. And why? Because in endo, all our work comes from the occlusal surface, where we create the access cavity. We don't need exposure of adjacent teeth or the interproximal areas. So isolating just that one tooth is perfect. But if you are doing restorative work, it's a different story. Here, we need to access the tooth from multiple angles, not just occlusal, but also buccal, lingual, palatal, and interproximal surfaces. Think about restoring a class 2 cavity. If you only isolate one tooth, you won't be able to see or manage the work properly. That's why for restorative procedures, isolation is broader. Now let me show you how extension of isolation is planned case by case. If you are working on incisors or the mesial surfaces of canines, usually isolation should be performed from first premolar to first premolar. And in this situation, it is not mandatory to use the metal retainers. You don't need them. You can secure with a piece of rubber dam sheet that is about the isolation of incisors and the mesial surfaces of canines. And next, if there is any class 5 lesion on the canine, we need more space to work. So, the isolation should be from the first molar on that side to the opposite lateral incisor. For premolars, punch at least 1 or 2 teeth distal to the tooth being treated and extend anteriorly to the opposite lateral incisor. And for molars, go as far back distally as you can and extend to opposite lateral incisor. The broader span ensures a dry field, better visibility, and space for proper finger rests for both you and your assistant. And here is a general rule. For most procedures, at least 3 teeth should be isolated. Endodontics is the only exception. So always plan your extension based on the procedure. Minimal for endo, broad for restorative.